Hello everyone, I'm Charlotte Kilpatrick, reporting for Vaccine Nation from the World Vaccine Congress in Washington. I'm delighted that today we're joined by Dr. Sandberg of Mabtech. Thank you so much for joining us.
Absolutely.
To kick us off, would you kindly introduce yourself and your role within the organization?
Like you said, my name is Dr. Sandberg, and I am the product manager for ELISpot and FluoroSpot at Mabtech. So I oversee day-to-day things with the assays themselves, trying to improve them, writing a lot of content for our website, sort of troubleshooting guides, different blog posts highlighting excellent research that we've seen researchers use ELISpot and FluoroSpot for. Working in a lot of different departments at Mabtech, just trying to improve our products and finding out how customers are using them as well.
Fantastic. So we'll touch a bit on the products and the uses a bit later, but you're joining us to discuss the role of these assays in characterizing vaccine-induced immune responses. Can you tell us a bit about the key concerns you're going to explore here?
Yeah, so ELISpot and now FluoroSpot, they are very well-established assays. The first ELISpot assay was done in the late 80s, so it's an assay that's been around for a long time, and it's a really great standardized assay that has been key in the vaccine field. It was monumental in assessing new HIV vaccines in the 90s, and now it's also been essential when evaluating the new COVID-19 vaccines as well. And then in the early 2000s, people started exploring, rather than doing the enzymatic development of ELISpot, replacing that with using fluorophore detection. And with that also allows the opportunity to do multiplexing. So with the same number of cells, you can look at up to 4 different analytes from the same cells those analytes being secreted by those cells at the same time. So it really is quite a powerful way to use the same sample size, but get a lot more data out of your cell sample.
Fantastic, that sounds really exciting. So could you tell us a bit about your organization? Are you distinguishing yourself from competitors in this space, or are you meeting an unmet need that you've identified?
So Mabtech, what makes us unique, I think, is that we are very much a one-stop shop for a lot of these things. We develop all of the monoclonal antibodies in-house in Stockholm. And that's what we're really good at. We were started by 3 PhD students from Stockholm University. They were really good at making monoclonal antibodies. And then they had researchers ask them, could you make this mAb for us? Could you make this mAb? So they decided to start a business. And it was around the same time that ELISpot started taking off. So they developed an interferon gamma monoclonal antibody pair, which is now the most cited mouse and human monoclonal antibody pair for interferon gamma since then. So because we control everything, we produce everything in-house, from the monoclonal antibodies to the actual ELISpot and FluoroSpot kits themselves, and do all the conjugations, and now we offer, personally, what I think the best instruments on the market for researchers to really get the most data out of their assays. We really can be a one-stop shop. And I think we're also really good at sort of customer support side of things. We love getting in contact with the researchers, hearing how they're using our kits and how they're using ELISpot and FluoroSpot in ways that we didn't think possible at first. So it's really fun that we still get to attend conferences like this and get to meet people in real life.
Fantastic, thank you. So are you able to give us any examples of some recent uses of these products?
Yeah, so publication that came out in Nature last year, I think it was in March or April, there was a group that has developed a new neoantigen cancer vaccine for pancreatic patients. So they actually were able to, where they used ELISpot to sort of evaluate T-cell responses after vaccination. So they excised the tumor from these patients and were able to sequence those and create new mRNA vaccines against these tumor antigens. And so they used ELISpot, interferon gamma ELISpot, prior to vaccination, after the vaccines, and then after a booster dose as well. And it was really nice to see that, this standardized assay is still being used today in brand new vaccine fields. Cancer vaccines are the future of a lot of the vaccine field. So it's really exciting to see that this well-established assay is still important to test the functionality of these T cells.
Absolutely, that's a testament to the value that it's had.
Exactly.
Yeah, great. So my final question is, what are you looking forward to at the Congress, or what do you hope to leave having achieved?
Yeah, it's really fun just going around and meeting everyone in real life, especially now in the age of a lot of remote work. It's nice to be able to get to see people, hear about new vaccine strategies, new adjuvants. I'll be giving a talk tomorrow as well. So it's always fun to get some feedback there and also meet a lot of our customers directly and sort of see how we can continue helping them.
Fantastic.
So I think just overall the networking is really great.
Thank you so much for your time.
Thank you.